Okay, so, right, we'll just use this one. So we see pericardial sac, right, this outer wrapping, okay, and I'm just going to start from the outermost, work my way in, okay? So this outer part of our pericardial sac is the fibrous pericardium, right? The inner part, like this inside layer, is the parietal pericardium, and then what's actually on the heart itself is visceral pericardium, okay? Now, we can see anterior view because the auricles, these little flappy, kind of scalloped or feathered edges, are coming out at us, right? So this is anterior view. Now, another thing that I can see, and it's not too bad here, I have one vessel, and I have a second vessel that's kind of curving out. This is going to be the aorta, and then I have branches. This is going to be pulmonary trunk, and then I have a third vessel that's incredibly thin-walled. In fact, it's collapsed on itself. This is going to be superior vena cava. So when you compare that with your pictures, right, you think about your vessels here at the base, this is base, as a 1, 2, 3 kind of orientation. Your point is the apex, okay? Yeah. All right, so if we open this up, okay, so we need to be able to see and determine left from right. We do that with very thick outer wall is your left side, thinner outer wall is your right side. You have a divider in the middle. This is your septum, and this one in particular is interventricular septum. And then we have to determine what your chambers are. So your dividers between chambers are your valves, right? So I'm going to open this up, and valves look like flappy things with strings on them for the AV valves. So this, we're on the left side, left AV valve, right? Or bicuspid valve, or mitral valve, okay? So above the valves, left atrium, below this valve, left ventricle. Attached to the AV valves are going to be these strings, which are chordae tendineae, or tendinous cords, and these bulges of muscle. This is a huge bulge coming out from this ventricular wall, papillary muscle, okay? And it would be the same way if we go over to the right side, right? I'm going to kind of spread this out. So again, valves are flappy, okay? So now this is the right AV valve or tricuspid valve. We have chordae tendineae, bulge, papillary muscle, right atrium above, right ventricle below the valve, all right? Now the only other things really that we can see well is I do have another valve here. This is a flappy thing, so it's a valve. This one, if I'm tracing this, coming from our left ventricle, I have a pathway. This is going to go into a vessel. And if I trace it and follow it out, it's going to give me a branch. But where I'm at, and I can feel this probe right here, this is the aorta. So it arises, it comes out of the left ventricle. So at the base of it, the start of it, this is the aortic semilunar valve. Okay, do we see that? Yeah. And then we would have something very similar with the pulmonary trunk, which is this one. Okay, it comes out of the right ventricle. And I can't see that pulmonary semilunar valve in this heart. I've seen them in other hearts. If they're cut this way, then you can see where that valve is at the base of it, just like it is at the base of the aorta. It's very similar, and they look the same. Okay?
Look at that. Look at that.
Now, one thing we might want to mention, I'm not sure we can see it well on this one. I think we can. So we mentioned that we have this really thin-walled vessel here. This is going to be part of the superior vena cava coming from above. We also have a vessel.
Oh boy.
If I can find it, here it is. It's been cut. Coming from below. This is the inferior vena cava. So coming from below the heart versus from above the heart, both of those empty into the right atrium. Okay? All right. Is that good?